Hello, and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported, and you're going to get some information that you can actually use. So don't worry, I got you. So welcome back, everybody. Today I'm just going to be talking, a little bit about me and how I started doing this job as an optometrist 22 years ago, and why I sound like this, but I'm coming to you from a nice little armchair in the southeast of England. I also have a fantastic guest today. It's one of my most difficult patients, but one of my most rewarding patients. So welcome everybody to the show today. So without further ado, I'd like to introduce, again, my most difficult but rewarding patient, my husband, Mr. James Jerome. Yay, James, welcome to the show.
Hello.
How does it feel to be on my podcast?
Scary.
Now, James, he listens to a lot of podcasts. He's a podcast person. And when I told him that I was going to be making my own podcast, he was like, have you ever listened to a podcast before? I was like, not really, but I think I'm going to give it a go. Because James is actually one of the people that inspired me to do the podcast, because he saw how well that I talked to patients in the room and how well I explained things. And they came out and were like, wow, nobody's ever explained it that way to me before. And he said, you're really, really good in the room. So this is a way for me to take that patient education that I like to do to a wider audience. So, yeah. Thank you, James.
No worries.
Yeah. So what I thought I'd do is I thought I'd start out a little bit about me first, and then we'll chat with James. So I started doing this probably about 22 years ago. I think I calculated last night. It was 22 years ago. Gosh, it seems like that's a long time to be doing it. But yet I am old enough to have been working 22 years. I can't believe it. So how I started was I never thought about being an optometrist. I actually wanted to be a fashion designer. I wanted to be a school teacher. I wanted to be a hairdresser. I wanted to be a marine biologist. That was the last thing. So when I went off to my undergrad university, I was studying biology and I was going to be a marine biologist. But there was a class called botany where I had to learn all these names of plants, and I thought, I'm terrible at it. I can't remember stuff. So I panicked, and my professor at university, he said, well, you did really well in this physics course. Why don't you just think about studying physics? So I did. But again, I had no idea what I wanted to do with physics. So it was my last year of undergrad at university, and I went for my routine eye appointment. And with my really nice optometrist, Dr. McQuaig of Alma, Georgia, shout out to Dr. McQuaig. He's still practicing, I believe. And I had my eyes tested by Dr. McQuaig. Now, Dr. McQuaig says to me when I'm there, he was like, Valarie, what are you going to do when you graduate? And I was like, I don't know, go to grad school. And I don't know if my parents put him up to that or not. You know, my mom and my late father, so maybe they did. They're like, what are you going to do about this? So then I said, do you like your job? And he said, actually, I love what I do. He said, why don't you stick around for the day? So I stuck around for that day, and that changed the course of my life. And I went to optometry school. So I did 4 years of undergrad. And in America, you have to do 4 years of optometry school to get to do the job of an optometrist. So yeah, that's how I started. And then I had a nice little practice in Richmond, Virginia. And then I moved down to Florida, where I thought I was going to live forever and a day. And I went on a holiday to Napa Valley, California. And when I was there, that's when I met this guy, James. So James, do you want to tell how we met, or should I? But let's keep it clean.
It was, you went on vacation,
yeah,
Americans say, and we went on holiday.
Yep.
I went with a group of cycling friends to ride our bikes for 3 weeks around Northern California. We were doing the single speed world championships, which sounds fancy, but it was literally just a meet up of a load of people. We'd ride our bikes all into the same crazy stuff that we do. And we were just in the local bar one night in Napa. and talking away and wondering what we were going to be doing next day. And Valerie's friends heard us, really. They didn't spot us. They said, I think there's a load of Brits over in the corner. So Valarie was like, oh, a load of Brits. And I said, well, luckily I went with a load of ugly people because I stood out, obviously. It wasn't just the hair or anything like that. So she just bought us a drink. Well, she didn't buy a drink. A friend of hers bought a drink and gave them to us, and then was like, oh, well, let's go and have a chat. So I went over and started chatting, and from then on, it started to chat.
Yeah, and I will say, it was honestly love at first sight. I remember he had these beautiful blue eyes. He still has beautiful blue eyes, but yeah. So my friend, she went to the toilets, as we say here in England, the bathroom, as we say in America. She got back. It was Anna, and she was like, "Oh my God, there is a table full of British guys over there," and we were like, "What? Oh my God, we love British accents." So my friend had the bar tab going, and so I told the bartender, I said, "Just put these drinks on our tab." And when those guys come up to order their drinks next, just give them all their drinks and say they're from us. Welcome to America. So it was James's turn to buy the round for his friends. So
I got away with that one.
He got lucky that night. So yeah, so that is why I'm here. So we dated back and forth for a while. We got married, and yeah, so I'm here. So again, we talked about how you are my most difficult but most rewarding patient. Would you agree with that statement?
Yes. Well, as luck would have it, I bumped into an optometrist, or I used to call an optician in America. So I bumped into her, and my eyes they're pretty complex and bad. And it was just like out of chance, really. I met someone that could actually help me.
And you didn't know who I was at first? You didn't know what an optometrist was?
No, I'd never heard the word optometrist. I just said, I kept on saying, I remember saying, you're an optician, right? And she was like, no, I'm an optometrist. She said, the optician makes the glasses. We test the eyes and check their eye health and do all that. And I thought, I don't know, I sound a lot like my optician. And it carried on like that. And I explained that I'm wearing contact lenses. I was wearing contact lenses at the time because I love to wear contact lenses whilst riding a bike. Just gives you that freedom of being able to wear cycling glasses and stuff like that. And I just said, the strange thing with these contact lenses, though, every time I open and close my eyes, they're just a bit scratchy. They feel like grains of sand in my eyes all the time. And she said, well, you should go back and, have that looked at. And I said, no, I have been back. I said, my optometrist told me that's completely normal. I put a foreign body in my eye and I should be able to feel it. He said, I thought, and I just took it as that's the way it is. But as it turns out, now I know now that it's basically I was putting a contact lens that they had available. It wasn't really the contact lens for me. Yeah. They just tested my eyes, said, you can use this contact lens. The only one they had, really. They didn't offer anything else. I didn't even know anything else was on offer.
Yeah.
So literally I wore that contact lens and put up with the scratchiness.
Yeah.
It's only now I don't, obviously I've had them fitted for me, the right brand, the right, and they're perfect now. I will go to bed sometimes and not even realise I've got them in. Well, I can see the TV still, and usually I can't see anything by this time once I've taken them out. So that's one of the things that we talked about was that as we talked about a lot of things when we first met, but we did talk about eye stuff as well. And he was like, I can't even wear these contacts for wear them for when I cycle and I have to come out. I literally would only wear them for cycling.
And I thought, what waste of a daily replacement lens.
I couldn't wait to get them out.
Yeah.
It's like, but I enjoyed it. I put up with them enough to enjoy cycling. But as soon as I was finished, I always had my glasses ready for when I finished. I then take my contact lens out, finally pluck up the courage to take them out of my eyes.
Yeah.
And then, that's another story. But trying to get contact lenses in my eyes are...
Well, I use you as an example a lot of times when patients come in and they're like, oh, aren't contacts supposed to feel like that? And I was like, no, actually, I took my husband out of contacts, out of his scratchy, cheap daily lenses into a nice daily replacement lens. And he actually says he forgets that they're in there. And I don't think a lot of people realize that sometimes with contacts, with most people, you should be able to kind of forget that they're in there. Yeah,
I take it for granted now when I put them in how good they are. But a lot of people even say, why don't you just get them lasered?
Yeah.
But I feel this is the perfect adaptation, really. I've put a contact lens in and I have normal eyesight. It's like,
If it ain't broke, don't
Yeah,
fix it, right?
I can't imagine. I'm very sensitive with my eyes anyway. Not that anyone knows, but
Yeah.
I just didn't fancy then zapping a laser in my eye to try and correct something, which sometimes will give you like a. I mean, Valarie had LASIK done years ago.
Well, to correct my long distance, but I didn't realize that one day I'd have older.
Yeah, and she's honestly
I
saying
need glasses for close.
she says sometimes when she looks at bright lights of a night time, they'll give like a starburst.
Yeah,
I thought
they do.
that doesn't sound very good either. I thought,
You don't-
that doesn't sound very good. And I thought, I don't fancy. I like crystal vision. I do like my vision to be very good. I'm very lucky to be able to have it corrected.
Yeah. Now, earlier you said you're kind of squeamish, or you have to get up the nerve and the courage to take your contacts out. And I can vouch for this, that you're still like this.
Yeah.
22 years later, after you probably first worn contacts. You probably started wearing contacts about the same time as I graduated from university.
I expect so.
You are really nervous when it comes to eyes. Do you have any like tips for the general public or people coming in to get their eyes checked, like how to feel more relaxed when you get an eye test, or any tips, or maybe what you should say before you get your eyes tested?
Just be honest with them. I mean, I went to a practice that basically you were in the chair and out the chair. I wasn't really given much. They were just there to make sure I was able to buy glasses. Basically, they wanted a change, but weren't really that willing on explaining why it had changed.
Yeah.
So they were like, here's your glasses. You need a new prescription. I thought, a year ago, and he just got these glasses. And I've worn glasses from a very young age, so I'm always looking after my glasses. In fact, when I see Valerie's glasses led down and she's put them on the lenses, face stores them down, I'm forever flipping them over, because I was always
That's what I
taught.
preach, right? Don't do what I do.
I was always taught it scratches the lenses, and I was told by my mum and dad these glasses are expensive, even though I had the national health glasses.
Yes, tell us about your first pair of glasses you ever had.
Well, I think I was about 6 or 7 when I needed glasses, and when I finally had my eyes tested, I think it was spotted at the school. They thought, this guy can't see.
Yeah,
he's like messing around at the back of the class.
Yeah,
and it wasn't until I had my eyes tested, and then they put the lenses in front of your eye, 1 or 2. And I realised that it could be. I was living in Minecraft world for a long time, I think. And then I'd walk out and like realise that most buildings had edges, and I could see individual leaves on trees. It was amazing for me. Rather than just a green tree, I could see all the branches, and it was brilliant.
Like a new world.
But I had the worst glasses in the world. They were. If anyone's familiar with Jeffrey Dahmer, I had those glasses. But to soften them up from obviously not being a serial killer, I had little Roland rats on the side of my glasses.
Okay.
So,
I don't know we didn't have it in America.
Roland rat. He was like a children's.
Oh, was he? Oh.
A TV program. Yeah. He's the best.
Yeah.
But I love Roland rat, and they happen to do the Jeffrey Dahmer glasses with Roland rats on them.
Yay.
So but my lenses weren't that thick at the start. Because I'd only just kind of gone into glasses. I wouldn't be able to tell you what they were, but I was wearing them, and from then on I was wearing glasses, and there was no other option. But if I wanted to see, I could wear glasses. I was lucky enough to be able to see, have corrected vision. So I put up glasses. I mean, they fell off all the time, and then when I started doing judo, when I was 6 years old, I then have to take them off to do it. And then as long as I got hold, and we were all wearing white, it's like you can't see anyone. Yeah. As long as I got a grip on someone, I was able to. Then you can fight. Then just have to close your eyes, then as soon as I finished, I'd have to put my glasses back on so I could see what I'm doing.
Yeah. So it's nice that kids these days have all options.
Yeah. I mean, when I could wear contact lenses and do judo, it means I used to be able to see myself getting hurt then, rather than. Oh. So it was game changing contact lenses were for me.
Yeah.
That's the biggest thing I think for me.
Yeah.
Just being able to do that.
But so thank you for sharing that tip about telling anxious patients. I've always tell patients, just be upfront with us. Just tell us that you're anxious. I tell some patients, do you like to look at pictures of your eyes? Because sometimes people don't like to look at the pictures of their eyes, do they? They get a bit squeamish. So I tell them to look away. And sometimes we have to be careful with the light, although you have this theory of what I do with you with light.
I'm pretty sure Valarie turns the light up. She's looking through the slit lamp to look at the back of the eye. And I'm sure she turns the light up as bright as it can, because I can't deal with the light in my eye. And I'm sure she's messing me about.
Maybe.
No one else comes out there goes, God, that light was terribly bright and I can't see now. And I'm the only one that has that experience, I think.
Maybe not.
And she tortures me because of that.
Yeah.
And the fact that I can't stand an eye drop. I can't have her put a contact lens in my eye.
Yeah.
It has to be me that does it.
Yeah. You don't like when we do the pressure check.
Oh.
Because I thought that you would, the air puff is dramatic. So I don't do the air puff for people. I do one that I think is a little bit more accurate. It's called an eye care. And it's like this little probe, but you say the probe is just as bad.
Yeah, it feels like you're coming towards me with a sharp cocktail stick. That's what it feels like.
It's not anything like that. But yeah,
it feels. And then when she says, "I've done it," and I'm thinking, she didn't do it. I think she's just saying that to me just to get me out of the chair and stop moaning.
No. And that's why I say you're my most difficult patient.
Yeah.
And if we have to train new staff on a new procedure, or I'm trying to show another optometrist something we do, I do always use you as a patient. I think because if I can show them how the most difficult patient will be, everybody else will be easier. So thank you all throughout the years for being my little guinea pig.
I try.
Yeah, thank you.
Yeah, the IPL is the newest one that I'm a guinea pig for.
Yeah, that's our dry eye treatment, intense pulse light.
Yeah, and that can be quite. I think it's because you can't see what you're doing. I mean, it's explained to you exactly what's happening, but it's when your eyes are closed and the cooling gel goes on your eyes.
Yeah.
It can feel uncomfortable because it's not a normal procedure.
Yeah.
But the results you get from it. I mean, I don't have dry eyes, but from some past patients and some Q&As that she's done.
Yeah.
It's like, it's game changer for anyone with dry eyes because it's so horrible.
It is. So dry eyes would be one of those cool, fascinating things that you've seen me be able to do for people. Is there anything else that, like anything being a spouse of an optometrist, you think, wow, that's amazing. That's a really good profession. I'm glad my spouse does it.
The contact lenses, really.
Yeah.
It's fitting me in the right contact lens. I think if I had never met Valarie, I'd still be opening and closing my eyes with like regret every time I do it.
Yeah.
Like the scratchiness that I used to feel.
Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.